The first one says that my daughter is 15 years. Her sleep cycle is really messed up. She does not sleep until 1 to 2 a.m. Or close to dawn, and she sleeps around 10 hours. She struggles during the regular school time because he needs more sleep. So what do I do with him?
Hi, so again, Dr. Shah here. There could be several factors there, right? I can't probably pinpoint everything because we go in a lot of detail when this kind of situation occurs, whether there is a pathological disorder a person is experiencing, a kid is experiencing, versus it's just a function because school is out and so forth. But I can give you some general idea that important key is to, even if it is late, first to fix to one particular cycle. So for example, fix the wake up time first whenever it's most comfortable to wake up. Keep it consistent over next few weeks. Calculate back the bedtime according to age I mentioned, and it should be around that. Once that is fixed, over the period, our body can adjust to shifting the clock by about 30 minutes a week. Think it's somewhat like if you went to California and came back to Cleveland, your body will take some time to adjust the clock, right? So every week, if you move that clock ahead, means your wake up time and bedtime ahead by 30 minutes, that may, by the time it's time to start the school, that may be sufficient and so forth. Also, like having sunlight but at a specific timing in the morning every day at the same time can help for about half an hour. So those are general concepts. If there are other issues, you may need a little bit more detail understanding of whether there are problems beyond that going on, beyond the body clock issue.
Thank you. The next question I have is what could be going on if there are jolts while sleeping? Is there a
Jolts?
clear or yeah, jolt while sleeping?
Well, I think again, we probably need to go into more specifics of what this jolt entails. Is it just the leg movements? Some patients with restless leg syndrome could have leg movements during the sleep, or is it something beyond those leg movements? I mean, are these jolts extending to the other parts of the body? One of the other differential diagnoses could be something as serious as nocturnal seizures. Folks may have seizures during the nighttime, but I think it probably may require more extensive history, really what is going on, what time of the night it is occurring, what part of the body it is happening. Are they the same every night? How often does it happen? Anything that brings it on, brings it off? So there could be many possibilities, is what I'm trying to say.
Yeah, so it should be evaluated. The next one is it okay to take melatonin? Is it habit forming? And is it recommended duration after which you should not take, or is it okay to take in the afternoon sleep?
Sure. So number one, melatonin is a very different molecule compared to many of us understand, right? And it follows like day and night cycle. So a lot of time we use it as a sleep aid at the bedtime. Is it harmful? Probably no. But in general, if you have a good pattern properly developed with those certain behavioral measures and so forth, you shouldn't need melatonin to begin with, right? Typically, it's not used in the afternoon because, as I said, the timing of the day when you use it or key is very important and key. Typically, melatonin is very low during the afternoon. So if you take it in the afternoon, it's not going to be super effective or needed. Third, there are two uses of melatonin. One is what we call sedating use, means to use it at the bedtime to help you fall asleep as a sleep aid. In general, except for very young age, we have not seen that to be very effective for that purpose. Means if you have insomnia, it may work, but it's not very effective. What is second use is what we call to shift the cycle, means in somebody like delayed sleep phase or delayed circadian rhythm, that is you can use it for that purpose, but it is precisely calculated timing based on your current sleep wake schedule and as a use as a therapeutic. So in general, our take is that if you have a properly behaviorally change your sleep wake schedule, you shouldn't need it and so forth. It's not habit forming in general compared to like medications otherwise we have described. There is wide variety of dose. It's over the counter. It's not regulated by FDA. There is even study looking at least 40 different types of brand, and it proved that what they claim inside their brand, like if it says 1 milligram, there is variation of about 30 minus 37% to plus 400%. So because of that, the effectiveness may really vary on what you are trying to use it for. So my suggestion would be to figure out why do you need it, and go it according to that, and so forth.
Yeah, thank you. The next question is why? What is the cause and cure for teeth grinding while sleeping?
Yeah, teeth grinding or bruxism is very common. It can be induced by stress. Stress is one of the actually common factors to induce bruxism. It could also be seen in obstructive sleep apnea, actually. So the treatment is trying to eliminate the stress. There are mouthpieces out there which could be made by dentists that could sort of help reduce this teeth grinding. The effect it could have is that it can lead to wear and tear of the teeth, and some people may also have pains in the jaw and so forth. But reducing the stress, getting good sleep, seeing if by any chance sleep apnea is there, and then oral pieces, the mouthpieces could be helpful.
Um, next question is I rarely get dreams. Does it mean that I'm not getting enough REM sleep?
So that's a good question. So all of us do dream. Some of us may not remember, and this is proven actually in research and so forth, that many of us tend to remember this vivid sort of dreams about stories and stories in the morning, or some of us just remember patches of it, or some of us don't remember at all. Generally, if you don't see dreams, does not mean you're not getting dreams. It's just that you next day, when you're fully aware, you may not be remembering them and so forth. As long as your sleep quality is good, means you're refreshed in the morning, you are feeling great, I would not worry about it and so forth.
Okay, so good dream is good.
Yes.
Is reading a physical book okay during that buffer time?
Yeah, so paper are not a problem. Physical books are actually a good habit. One thing I would suggest is, if you don't have problem giving up like interesting book, if you're reading like a novel and you get sucked into reading that and don't fall asleep or don't go to bed on time, that's a problem. But if you say, okay, 10 o'clock is why I'm gonna give up, and if you have that uh, that ability to stop yourself, that's great. Actually, it doesn't have any direct negative impact. Many times people who have trouble falling asleep, we tell them that read something from paper which is really boring to make you feel yawn and fall asleep and so forth. So it's one of the hygiene techniques we teach as a part of the insomnia treatment. So it doesn't have those adverse effects like LEDs and LCDs and so forth. So papers are pretty good.
Okay, that explains why my textbooks may put me to sleep every time.
Yeah, medical school textbooks.
Okay. Is there a good position in which you sleep to improve the quality?
So typically, there is no proven that one position is better than other, unless you have, as Dr. Walia mentioned, like sleep apnea tends to be worse on the back. If you don't have that, it's not proven that the sideway or back is better than one or other. And generally, once you fall asleep, a lot of time it's not in your hands either to stay in one particular position, unless you use a device like Dr. Walia mentioned. So there is no advantage of like sideways versus backwards or so forth in being better than other.
Okay. Is snoring bad for kids? Is it a problem
For kids,
Oh, kids. Oh, I'm
for
sorry.
kids? Yeah, yeah,
Teeth.
for kids.
Kids. Oh, yes. So snoring is, compared to adults, snoring is definitely not normal in kids. Not every kid who snores have substantial problem like sleep apnea. The kids who snore, half of them have sleep apnea, enough to require some form of treatment. Snoring beyond sleep apnea could also be sign of either allergies or some form of obstruction in the airways and so forth. So if you're in children, sleep apnea could be very different. They may not have sleepiness. They may have attention problems, hyperactivity, trouble in school, and so forth. Some kids tend to breathe through mouth. Some kids tend to older kids tend to feel like tired or sleepy, but most of the younger kids may not have those symptoms. So in snoring in conjunction with other symptoms I mentioned is happening, that's where you want to basically get evaluation. And in kids, the reason for obstructive sleep apnea is slightly different than adult. It could be more so related to adenoids and tonsils being large compared to weight is much more predominant factor in adolescent or age above and so forth. So it's a very different reason in kids and so forth. So in general, snoring is not normal, but may not be always big enough problem to require immediate intervention.
In the night, I wake up at 3 a.m. and it's hard to go back to sleep again. Is there a solution for me?
Well, that's called sleep maintenance insomnia. Again, I would want to go into the depth of why somebody is waking up. There may be a reason, there may be a medical reason, or there may be a sleep reason, or there may be a no reason. Some folks tend to think a lot, either before going to sleep or in the middle of the sleep, and what we call as psychophysiological insomnia. If that's the reason, that needs to be treated separately by sleep psychotherapy is what we say. So we tend to look at the reason, what is the reason, and try to solve that reason. And in very rare circumstances, there could be medications, but we generally don't resort to the medications. So my 2 cents would be, if you do wake up in the middle of the sleep and it's been 20 minutes or so in your mind that you have not been able to go back to sleep, you want to leave the bedroom and do something boring and come back to bed only when you're sleepy. The idea is to associate the bed and bedroom to sleep.
Please tell us, what is the reason for sleep paralysis?
Yeah, so sleep paralysis is when you wake up in the middle of night, your body may feel that you cannot move and so forth, right? So it's a dream related phenomenon. What I mean by that, in dream sleep, our brain is very active, and heart and certain essential organs are active. However, the muscles or the peripheral muscles are nearly paralyzed. Otherwise, we'll all act in what we are seeing in dream and do crazy things in sleep, right? That's how humans are made. So if you are woke up in the middle of night from a dream sleep, sometimes your brain is awake, but body is still in that dream phase, and for a few seconds before you wake up. So that's what we call sleep paralysis. Most common reason for that is sleep deprivation, because if you don't get enough sleep, next 2 3 4 night or up to a week, you will have a lot of dream sleep. That's how body recovers, and that's why if you wake up from that dream sleep, you feel paralyzed. The other reasons are less common or rare. So to give you example, about 5 out of 1,000 patients who experience that could be related to narcolepsy, but that in general that it has other symptoms, for example daytime sleepiness and so forth. Or something which is disrupting the REM sleep or dream sleep, like sleep apnea or restless leg, like kicking. If that's waking you up from that dream sleep, you could feel that way. But most common reason is not having sufficient sleep.
And it's very, very common. And the thing is, it could be very scary for the patient. It's actually a very scary phenomenon, when your body is not able to move. But again, it's not dangerous. There's often reason to it, which is sleep deprivation.
Dr. Walia, you talked about OSA and the common treatment options using CPAP. An issue with CPAP for many patients is being compliant. How do you work around this issue?
Yeah, I mean, CPAP compliance may require a lot of hand holding with the patient, and it's something on you, so it does require some acclimation. So I don't blame anyone for that. So we try to sort of help troubleshoot whatever is coming in the way of compliance. Is it the mask issue? Is it the pressure issue? Is it something just getting used to it? Maybe use it during the daytime when watching TV. So be something being used to it. Is it the CPAP issue? Could it be transferred to BiPAP? So we sort of check on these patients very commonly and see what could we do to help them. Is it a nasal congestion? When folks are congested, it's hard to use something on you which is blowing in the air. We want to treat that nasal congestion. So checking on them Very commonly, we have a lot of modalities at Cleveland Clinic. We do daytime studies for these patients, where a technician work with them on one-on-one basis to again troubleshoot these issues, help alleviate any anxiety which is out there. We have group clinics to sort of which gives these interpersonal support to these patients, so they know they're not alone in the whole process. There's a whole host of things which we could do. But the good news is some of these times, it's salvageable. We are able to get these people to be compliant.
I would just add one more thing to that. One of the common thing I tend to see is lack of in-depth information and understanding of options out there. The technology compared to 5, 10, 15 years ago, it is like computers that advanced so quickly. There is like supermarket of different masks and the machine itself to improve the comfort. To give you example, there are 20 to 60 types of masks in the market. So a lot of time patients give up too early to begin with without giving it enough try in 3 to 6 months, because they just don't know about all these options out there. So before you, if you feel like there's a problem, you should contact either home care company you got the CPAP from, or talk to like the physician who have and go through these options, because as Dr. Walia mentioned, a lot of them can be salvageable.
How many hours before we sleep should we eat dinner?
Yeah,
No,
so
the other question is walking or a light exercise okay before sleep?
yeah, so both question I'll answer. So very close to bedtime, within last half an hour is when you want to avoid. Other times are okay, typically in terms of dinner and so forth. And a light snack before the bedtime sometimes can help actually fall asleep and so forth. So to not feel hungry in the middle of night and wake up from hunger and so forth, but not very heavy meals. And then exercise wise, again, within last hour or so forth can be stimulating with those adrenaline coming up. However, if you do it before, particularly let's say 2 hours or before the bedtime, it's very helpful because it generates those adenosine in the body, which as it gathers over the period of time by night, all those to combine helps us fall asleep. So not within that last hour to maximum 2 hour period. Some patients still can be fine within that 1 to 2 hour time, but not very close to the bedtime.
The most beneficial practice I can do it before I go to sleep. That will increase my sleep time. Is there any routine I can follow?
Yeah, so typically you want to keep it during that buffer zone, 15 to 30 minutes. There is no, each one of us can develop different routine, but something very calming and relaxing, short, no more than 3 steps, such as brushing followed by like a relaxing activity, like reading from the paper or listening to relaxing music, or some people like really like meditation or prayers. Those are the things, and then staying in that particular dark environment helps you really fall asleep and so forth. But there are several lot of individual variability in what helps and so forth, and not one or other has been proven to be better than other. So you can mix and match according to your lifestyle and put like about a 3-4 step routine in that buffer time between 15 to 30 minutes before bed.
And also, is there any certain food you will recommend or you to use or avoid before going to sleep?
So generally there is not high carb foods particularly have been shown to disrupt the sleep close to bedtime, and so forth. So that I would probably suggest avoiding. But the light snack like milk or so forth can be helpful right before the bedtime and so forth. Otherwise, there is not a lot of otherwise evidence about either a different kind of protein or fatty food or so forth to not even positive or negative evidence. Means we just don't have a lot of evidence to say whether one affects right before bedtime or not.
Okay, thank you. The next question I will read is, I feel tired as soon as I eat and feel sleepy in 30 minutes, whether it's breakfast or lunch or dinner. Otherwise, my sleep is generally good. Is there a reason?
Is that in the middle of again, timing is key in the afternoon? What I didn't go really more so because it's more technical concept is in the processes of circadian rhythm beyond what we talked about. So particularly in the morning, we are wide awake. By lunchtime or right after the lunch, we tend to have a dip. So all of us may experience that we may feel slightly sleepy, and then late afternoon we tend to feel wide awake. So if it's right after that lunchtime, that may not be completely abnormal. But if you're feeling after each meal, that it either you want to make sure that your quality and quantity is appropriate at the night, or you may be experiencing some form of like hypersomnia or sleepiness disorder if you have it other times and so forth. So you want to have somebody go in detail and help you figure out whether that's the case or versus a problem or not a problem.
Okay. Uh, I use auto sleep app in my iPhone while I'm sleeping. I see that I generally get only 2.5 to 3 hours of deep sleep per day, even though I sleep for about 6.5 to 8 hours. Is there a way you can tell me how to improve my deep sleep? And also, uh, yeah, are there any apps you recommend that I can use to sleep better?
No,
So yeah, so first it would be important. You mentioned that you sleep about 6 hours, 6.5, right? So it would be important to determine how did you measure that you're only sleeping 2 to 3 hours deep, right? Also, if you notice, our dream sleep is about a fourth of our time, which is one of the deep sleep, and a non-REM 3 sleep, which is the slow wave, is about 15% of sleep. So generally, very deep phase of sleep is about a 4 to about 40% of time. I mean, 25 to 40% of time of total amount we sleep, right? So if you have 2.5 hours out of 6, it may not be completely misplaced. One, in terms of technology, we have wearables, right? You can say I'm wearing Fitbit or other kind of wearables or apps and so forth. Those wearables or other apps which measure sleep have improved over the period of time, but they are not yet close to actually determining whether you're getting really deep or shallow sleep, close to medical testing, such as like nighttime sleep study. Or we have a medical device called actigraphy, which is medically titrated and so forth, looks like a watch. So even the actigraphy cannot exactly tell you whether you're going through dream sleep or not. It what all these devices do is they measure movement in sleep and try to help you determine what kind of movement equals approximately closer to sleep and what kind of movement are awake like. So it can give you a general idea of a pattern of sleep, but not yet very good in terms of determining whether truly you are in a deep sleep or not. That can be only done by measuring your brain waves, which is with the sleep study. So that's number one. And then in number two, with auto CPAP or any other kind of CPAP, right? If you are feeling that you're not able to wear it more than 2-3 hours, then those troubleshooting measure can help. Or you may have a secondary sleep disorder like insomnia or so forth, which would require like evaluation and going into the root cause of why you are having that problem, and addressing those and so forth. So in general, for phone apps, we are actually developing our own app for the information, but there is no particular one app seems to be better than other. White noise seems to help. So some of the app which allows like white noise can help. Cleveland Clinic has an app called Go to Sleep Program, which is actually a therapy, like a behavioral and psychological therapy for insomnia. It's an interactive program. So if you have insomnia, it can help. But for in general, it's not meant for patients who don't have or people who don't have insomnia and so forth. So there are no other like otherwise apps which are better than other or so forth.
Thank you. The next one is my daughter sleepwalks. It is not so frequent. She is 13 years. Recently, she came out of her room to me and then she was calling me. When I woke up, she asked me whether I need tissues. I'm worried and want to check with the doctor. Should I?
Yes, so sleepwalking is what we call parasomnias or event happening in sleep. That they particularly tend to happen from what we call slow wave or very deep phase of sleep and so forth. Does it always means that your child has a brain problem? Generally not. A large number of parasomnia may not have a brain pathology. What we call it is a problem of switch, means when they have to switch between deep phase of sleep, like slow wave and other times, they tend to their brain tend to slightly wake up, and their brain tend to be fascinatingly in both stages of where they sleep and awake at the same time, and so forth. So you see behaviors of both, means they look like glazed, they may not they recognize where they are, and they talk something which is completely out of place. It's very scary to see. The key is how can you keep them safe? That's number one. Number two, how frequently it's happening and they are prone to injury or not. If your answer of those three is if safety is compromised, they're prone to injury and they are frequent, then absolutely you should talk to the to somebody, because there's a lot you can do beyond making them sure them safe. You can figure out whether there are triggers underlying like sleep apnea, what is disrupting sleep, and other thing, and you can treat those and so forth. And in an extremely rare circumstances, once those are already taken care, if there is more frequent or somebody is prone to injury, there are some medications can help, but those are not very commonly, we don't tend to use it without addressing the underlying triggers.
Sleep deprivation can trigger
Yes.
it too, can precipitate it, because when you're sleep deprived, you're more likely to have slow wave sleep. If you're going to have this deep slow wave sleep, more likely to have arousals, more likely to have these sort of behaviors. But safety is the most important thing.
Thank you, doctor. And the next is I'm in 40s with a metabolic problem like hypothyroidism. Is it okay to have a short nap in the afternoon to be active in the evening? Otherwise, I feel so lazy and tired after 4 p.m.
Yeah, again, I would like to know, why is somebody so tired, and is it affecting your quality of life? If the sleepiness is affecting the quality of life, does it warrant any further evaluation? So in terms of naps, generally speaking, sort of shorter naps for 20 minutes for the earlier part of the day is okay. But we generally do not recommend naps at the later part of the day and or beyond 30 minutes or so, because it can take that sleep debt away if we take the naps at a later part of the day, and can enhance trouble falling asleep in the nighttime. So short naps in the earlier part of the day, but more importantly, why somebody has to take a nap, or is the sleepiness causing issues with life?
Thank you. One person has asked that I sleep 7 to 8 hours every day, but is it okay if I sleep from 1 o'clock in the morning to 8 or 9, or should I follow the same 10 to 7 routine?
Yeah, so basically there are a lot of misconception about timing of sleep, right? I mean, we are traditionally learned is early to go to bed and early to rise is better. So the key for sleep physician is there is no right or wrong time to sleep. The right or wrong time is, as I mentioned, dictated by your social needs. So think of somebody who is in a second shift worker, right? They come home at 11 or 12 and then they sleep from 1 to 8. For their lifestyle, that works fine. So as long as you can function during the daytime with that schedule, that is not a problem. Think somebody who's in India or China, like they're completely on a other opposite cycle of sleeping, or somebody who is in Hawaii, they are 5 hours away. So whose sleep cycle or timing of sleep is right? Nobody's, right? So it's important to put it in the context of your social needs. If you are able to get a good night of sleep for 1 to 9 or so forth, and your work or other things is completely fine or later, then there is nothing wrong with that.
Okay, so the duration is more important than exact timing.
So consistency, where whatever time you sleep, consistency every day is more important than when are you sleeping. Like 7 o'clock versus 1 o'clock. If you're sleeping one day 7 and second day 1 o'clock at night, that's a problem. If you're sleeping every day 1 o'clock to 9 o'clock, and if that works for your lifestyle, that's not a problem.
Is lying on the bed for 6 to 7 hours without a good quality sleep better, or sleeping 4 to 5 hours good sleep is better?
Yeah, so you're going into detail about some of the behavioral therapies we use for insomnia, right? So it needs to put on a context about whether you have a sleep problem or not. Generally, what a common technique we tend to teach is first after fixing the wake up time. This is not going to work if you don't fix the wake up time. And at the bedtime, if you have problems, then sleep is a learned process. So we all learn to fall asleep in certain environment. Our parents teach us as a baby, right? And we all have what we call sleep association. Means our brain tends to associate certain things in our environment with either falling asleep or staying awake. For example, I need certain size of pillow to fall asleep. You may by yourself experience that you need certain temperature, light, other things to fall asleep. So in general, if you are too long staying awake in the bed over the period of time, your brain develops a bed with association staying awake and so forth. And that's one of the component of what we call psychophysiologic insomnia and so forth. So we tend to say, okay, just guess if you are awake in the bed for 15-20 minutes, you may want to come out of bed, do something very relaxing and boring, and then get back to bed when you are drowsy. But this only is going to work if you have a fixed wake up time and so forth. So in general, staying too much more time in bed compared to what your body's needs are is going to develop tendency to go in a problematic way over the period of time.
Thank you. Nowadays, my sleeping time schedule has been disturbed. My right eye is twitching and fluttering for the last 2 weeks. Is it because of the change?
I will not be sure about this. I don't believe so. It may be something unrelated to sleep.
Okay. Yeah, better to get it checked out.
Yeah.
What is the average screen time for a 9-year-old? My daughter is having issues with the sleep. Is it because of this screen time?
It could be one of the reason, if not so forth. Particularly screen time during the daytime, according to what we learn about American Academy of Pediatrics, right? And I'm talking about non-school related screen time. There is no way to avoid in this current life to completely get away from screens, right? I mean, school is online, so there is no way you're going to avoid. So two important concepts: non-school related screen should be limited to no more than 2 hours a day, and not within last 30 to 60 minutes of bedtime. So I hope that helps, and so forth. So that's what is recommended. School related screen time, you can have it separately.
Okay, thank you. And does doing pranayama or meditation before sleep helps?
Yeah, so there are no well-designed studies which can say one or other way around, right? But it is one of the science, like a lot of other are ancient sciences. So in general, when we see patients, we have seen a lot more positive impact reported by patients rather than any kind of problematic issue. So a lot of patients, particularly with meditation, can help. Pranayam yet is new for US US scientific community to basically study and so forth, but there is no downside to it, number one. Number two, a large number of people do report that it does help them to calm down. So I would recommend, if you make it a part of your routine, that may probably help if you are used to that.
Thank you. My kid sweats during the sleep, even when AC is on. Is there a problem?
So you said your kid what does?
Sweating
Sweating.
during sleep.
Sure.
Yeah.
So there are sweating during sleep could be by itself a non-problematic situation, means just some people have tendency to do so. But in the context of snoring or symptoms of sleep apnea, other symptoms such as breathing through mouth, you noticing witness pauses like choking or other, it could be due to the sleep apnea itself or combination of both. So if your child does not have those symptoms, usually it's not a big problem. If your child has it, you should probably get it checked.
You. Does the Navy sleep trick, which is tighten, then relax your entire body, followed by a deep breathing, does it work?
So I do not know what exactly is Navy sleep trick, but I can tell you for sure deep breathing and relaxation is part of the relaxation exercise. And even if you have insomnia, even if you don't have it, our sleep psychologists, or we go ahead and teach that, because it does help you allow to calm your body and brain down. So if you have during that buffer time, if you make it part of like just deep breathing, focusing on that breathing, it may help, but it needs a practice again and again.
Okay. So we have about 5 more minutes. I want to continue the questions.
Sure.
During the school, is it okay if I take a nap for like 4 hours after the school and stay awake till 3 a.m.? Because if I don't take the nap, I cannot concentrate when I do the homework.
Right. So generally, I would suggest that you may have 4-hour nap is a lot. First of all, right after the school, right? Means you may have gone into vicious cycle of not being able to fall asleep at night, next day napping, and that also again contributing to not being able to sleep at night. So your body cycle may have disrupted. That's number one. So it could be a circadian rhythm or body clock problem, or if you are very sleepy even during school time, then it could be a sleepiness problem. So that long nap is usually not normal, and so forth. So you may want to work on fixing things during current times, when if school is out, until the school is about to start.
Does taking magnesium help in the quality of sleep?
Magnesium has been shown to help with restless leg syndrome, but again, we don't have very robust data to support it. So there are some studies to show it may improve the sleep, especially restless leg syndrome.
Okay. What is the cure for restless leg syndrome?
Pardon me, what is acute?
How do they treat? How do they treat restless leg?
What is the
Doesn't
cure? Yeah, cure.
what is the cure
How do
for
you treat it?
leg syndrome?
Yeah.
So yeah, so it depends how bad is the restless leg syndrome. There are non-medication mode of treating it and medication mode of treating it. There are certain things which can trigger restless leg syndrome. Certain medications, such as some antidepressants, can trigger restless leg syndrome. Caffeine can trigger restless leg syndrome. Sleep deprivation can trigger restless leg syndrome. So we first work on those things. And like I said, there are medications which work beautifully. The first thing that we check for restless leg syndrome is ferritin, which is a store of iron, which could be low in patients with restless legs. Improving, correcting that could improve restless legs. And there are certain medicines, what we call it, dopamine agonist, or gabapentin kind of medicines, which does work very well for restless legs. So it depends how bad is the restless legs, how frequent it is happening, and then we can sort of tailor the therapy according to that.
There is no cure though. It depends on the underlying problem. And sometimes younger kids, we tend to see it's mainly only due to iron deficiency. So in a lot of time, those kind of situation, it can go away if iron is treated. But generally, in older population, there may not be cure, but we can manage it pretty well.
Thank you, Dr. Shah and Walia. Final question, of course, is how do we get contact information about Dr. Shah and Dr. Walia?
Oh, we'll be happy to send it with PowerPoint, or we can put it at the end of the PowerPoint of our Sleep Disorder Center information. And then I think you're gonna send you had asked for the PowerPoint, right? So you'll have it on there.
Right. Yeah. We will be sending the whole session taped, recorded, as well as the PowerPoint link to the all who attended and all who registered. So if you can add all your reference books to read or videos to watch, or your contact information, that would be really great. Whatever you can provide.
Yeah, I can put the contact information and a link for Sleep Disorder Center.
I take it that the audience really loved the whole thing, and they're jumping with so many questions, and it's an important topic. And even if I take back saying that sleeping is not waste of time, that's a good information I take out of this the
Yeah.
whole webinar. Yeah, it is
Yes.
most useful time.
Yes.
So thank you for coming and clarifying everything, and thank you for your time. We thought it's going to be hour and a half. Now we almost 2 hours is gone. And
Yeah.
thank you everyone for attending the webinar, and I hope you learned a lot. Just